Hey everybody, Katie Harris here from Philly Wellness Center, and this is another video for the Beyond Mainstream Health. So today we're talking about hair restoration and the question, does hair restoration hurt? Are these treatments painful? We're going to break it down so that you know what to expect for the different types of hair restoration, including Rive, PRP, some hair transplants. So let's go ahead and get started. Okay, so there's different types of hair restoration therapies that you can do. One of them is our Rive with Exosomes therapy. This is needle-free, painless. We absolutely love this. It's amazing. This method uses exosomes, plant-based exosomes. They're completely natural. Their exosomes are tiny cell messengers that promote hair growth. They actually signal the cells to do what they're supposed to do. So if the hair follicle is alive, the exosomes go and say, hey, you need to pick up the pace here. You need to start growing, and they work amazingly. So the great part is that this is a completely needle-free process. So with Rive, we use ultrasound technology to drive the exosomes down to the level of the hair follicles. So we clean the scalp first and then use ultrasound, and ultrasound doesn't hurt. It actually feels really nice. And people fall asleep on the table while we're doing the ultrasound and driving the exosomes down into the hair follicles. So there's no need for injections. You don't have to worry about needles. It's not discomforting. It's actually very comfortable, relaxing. It's a painless experience, and there is a quick recovery with it. Now, red light therapy, right? So red light therapy is also pain-free. It's very relaxing. It's a great choice. You can do a laser cap. We have a Therabody. You can also sit under a panel. There's lots of different ways to do this. You can even get a home-based red light panel for yourself and use it at home. I would use it every day. Red light therapy is not going to hurt you. It's only going to help you. It does stimulate hair growth using red light diodes. It doesn't involve any needles. There's no invasive techniques. It's really, really nice. So generally, most people say it feels like a warm sensation on the scalp, especially if you're using one of those helmets that you can find online. We use Mito Red Light. We really love the quality of their of what they sell. It's a very high quality red light. So that's Mito, M-I-T-O. But there's no pain, there's no downtime. You do it every day. You can do it twice a day. If you have time, you can do it all day if you want it. You're not going to do any damage. So it is a great option. And it's also great to combine that with other treatment options for enhanced results. So in between, let's say, Rive therapy, you are going to use shampoos, special shampoos and conditioners and serums to help facilitate hair growth. Now, Nuvaderm is our laser that we use for hair growth. There's a special hair growth dial for it so that it does enhance what Rive already does. So we combine Nuvaderm with our Rive process. So if you come in and get hair restoration at Philly Wellness Center, you'll get Rive. We also use red light therapy using our Therabody, and then we finish off with the Nuvaderm. It's a thulium laser, and it helps regenerate hair growth at the follicle, which is really nice. By itself, it's not a standalone treatment, but when we use it with Rive and red light, it's amazing. Also painless. There's no pain associated with the Nuvaderm. Now, for the procedures that are a little bit more discomforting, if you will, there's the injectables and obviously hair transplants. So PRP and peptide injections, although we've moved away from PRP as our primary treatment for hair restoration. We love PRP. We use it as a filler for the face and the hands and anywhere that you have lumpy, bumpy tissue, we can stick filler in there. It smooths things out. It's amazing. But for hair, it's really not necessary because now we can use the exosomes with ultrasound, but it still has its place. People still use PRP. It just hurts, right? The scalp is very vascular. It's hard to block the entire scalp because you need a lot of lidocaine. And sometimes you can just get the surface, but if you're going down to the follicle, it just becomes underneath, it becomes more painful. Peptide injections, it's the same thing. It's still using a needle. Peptides are amazing. They can be very anti-inflammatory. Using the right peptide injections can make a difference, especially in moderate to severe cases. This might be a necessary evil, in which case we can use numbing and sedatives to help you through the process if needed. This would be considered a mildly discomforting. And depending on like PRP, if you're doing a big section, I mean, you could have 50 to 100 injections with PRP. With peptide injections, we usually do some sort of like triangulation of an area. So we would have like 3 injections and just triangulate an area, and the peptides would move into that area and help with the hair growth. So PRP, if you don't know what it is, it's just involving drawing a small amount of blood, processing it to concentrate the platelets, and then injecting it into your scalp. Since these are injections, there can be, obviously mild discomfort. You can use numbing cream to make it as comfortable as possible. And also sometimes people will do a slight pinching or pressure. So it is well tolerated, but after you get 50 injections, you're like, oh my gosh, stop. And then hair transplants, of course, it's a much more involved procedure, and it definitely gets much more uncomfortable. They do use local anesthetic injections that will numb the scalp. And once the scalp is numb, you don't feel too much during the actual transplant, whether it's follicular unit extraction, FUE, or follicular unit transplantation. You might feel some soreness or tightness in the scalp afterwards, but that's managed with over-the-counter pain medications. Well, just to be clear, we do not do hair transplants at the Philly Wellness Center, but we can certainly recommend somebody who does. Now, how do we manage pain? So no matter which treatment you choose, we would prioritize your comfort to make sure that the experience is as pleasant as possible. There are certain ways we can keep you comfortable. There's numbing creams that can be used prior to injection. We obviously don't need that with our pain-free hair restoration. But if you do need something, there's numbing creams. There are local anesthesia for more invasive procedures like hair transplants. And there's also mild sedatives that can be used as well. So mild sedatives can certainly help with the anxiety if you're really very concerned about that whole pain process. Especially if you have a low pain tolerance, or you just need it. Some people just need it, right? So our hair restoration treatment's painful for the most part? No. With options like Rive, you won't even need needles. You will be in a nice, relaxing, it's going to be an hour of us just playing with your hair and your scalp and massaging it we cleanse the scalp first, which feels really nice. And then the exosomes with ultrasound is amazing. And then the final piece is the laser, which also doesn't hurt, and red light doesn't hurt. So if you're opting for something like PRP, or you're going for a transplant, or we need to do peptides, the discomfort is minimal. Most people tolerate it okay. We do have options to manage discomfort and make it as pleasant as possible. So if you are interested in hair restoration, then you definitely want to call the Philly Wellness Center. If you found this video to be helpful, be sure to give us a thumbs up, hit the subscribe button, and leave your comments below, and we'll see you in the next video.